So hello everybody and welcome to our first meeting of our working group, the Traditional and Complementary Medicine, a working group from the International Society of Pediatric Oncology Global Health Network. I want at first to welcome our new co-chair, Dr. Roberto Carolus. May you introduce yourself, Roberto?
Sure. Good morning. I'm from Chile, so we are starting the day here. I'm really happy to be with Ahmed and today with this presentation. So thanks again for the introduction. I work in the south of Chile. We have a conventional and integrative oncology units in the south of Chile. So I'm really happy to be here today.
Thank you, Roberto, and welcome on board. I want just to remind all of you to renew your SIOP membership to be able to get all of the benefits from the SIOP website, from the SIOP Connect, to be with us in all of our meetings, to share with us in our research projects. Also, I want to remind you that the abstract submission have been opened to the next SIOP Congress, which will be held next October in Amsterdam. Now I want to welcome Professor Dr. Rejin Kebudi, Professor of Pediatric Hematology-Oncology and Chair of Department of Preventive Oncology at Istanbul University Hospital in the Oncology Institute. And she is also the Secretary General of the International Society of Pediatric Oncology and past co-chair of the SIOP-Supportive Care Network. Thank you, Rejin, for being with us.
Thank you so much. Well, dear friends, dear members of SIOP, dear members of the Traditional and Complementary Medicine group of the GHN, it's an honor to be here with you and to be the guest speaker. Thanks, Ahmed, for this invitation, and Roberto, welcome on board. As Secretary General, I welcome you on board as well, yeah. And well, as Secretary General, I'm really happy that we are having this year and last year a lot of non-Congress activities, educational webinars, and many people our member engagement is much, much more. Today, we will be talking about integrative and complementary treatment in supportive care for pediatric oncology. During the last SIOP annual meeting in 2025 in Honolulu, there was a session on integrative and complementary treatment where I also took part, and my colleagues also took part. Some of this information was also presented there, and I have added some additional information. So what is, we will be talking about, sorry, I wanted to, yeah. So we will talk about the definitions, objectives, integrative oncology in pediatric hematology-oncology in high and low middle income countries, the general principles, guidelines for specific therapies, and like from ASCO and SIOP, if there are, because there are few, safety considerations, which is very important, integrative oncology in pediatric hematology-oncology, especially in the Middle East, some of the studies that were done that I was in these studies as well. And that we will emphasize that patient and family education is important. And we will conclude all together and get the comments and the question answers at the end. So complementary medicine therapies are being administered in in a number of therapeutic contexts, either as an independent entity separate from conventional care, which we call alternative medicine. And we don't recommend alternative medicine. Or it can be given as in conjunction with standard medical care, which we call complementary medicine, or as an integral part of conventional cancer care, which we call integrative oncology, and that is what we want, in fact. And you will see in the literature a lot of synonyms like complementary alternative medicine, traditional complementary medicine, complementary traditional medicine, which usually talk about the same context. What is integrative oncology? Integrative oncology is a patient-centered, evidence-informed field of comprehensive cancer care that uses lifestyle modifications, mind-body practices, and natural products from different traditions alongside conventional cancer treatments. So we have to have the conventional cancer treatment, which is evidence-based, but we have to think holistically to integrate lifestyle modifications, mind-body practices, and natural products. And the goal is to enhance quality of life, to reduce side effects, to support immune function, and to improve physical and emotional well-being. And the general principles is a holistic approach focused on the whole child, including physical, emotional, spiritual, and social well-being. It has to be evidence-based practice. Use the therapies that have been supported by clinical evidence to ensure safety, which is very important, safety and efficacy. Efficacy is important, but safety is also even more important. And we have to collaborate in this with the families, with the oncologists, and if in your country there are integrative medicine specialists with them and the other healthcare providers and other healthcare professions as well. And due to the increasing interest in therapies outside of conventional Western medicine, the United States Congress established the National Center for Complementary and Integrative Health within the National Institute of Health in 1999. And the mission is to define, through scientific investigation, the usefulness and safety of complementary health approaches and their roles in improving healthcare. Guidelines for specific therapies include nutrition and dietary supplements. The goal is to optimize nutrition to support growth, development, and treatment tolerance. The recommendations is to conduct a nutritional assessment for each patient, to focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, to consider supplements under medical supervision only, to avoid unproven supplements or those that may interfere with treatment, such as high-dose antioxidants. The second guideline is for mind-body therapies. Examples include meditation, yoga, guided imagery, mindfulness, music therapy, and the benefits is to help manage pain, anxiety, stress, and to improve mood and quality of sleep. Acupuncture and acupressure are effective, have been found to be effective for managing chemotherapy-induced nausea and especially for pain and fatigue. But of course, this has to be done, especially in pediatric oncology, only with certified practitioners, and we have to monitor for adverse effects. Massage therapy also reduces anxiety, pain, and muscle tension, promotes relaxation and well-being. And the recommendations is to use them as gentle, child-specific techniques to ensure the therapist is trained in pediatric oncology massage and to avoid areas affected by radiation, surgery, and central lines. And of course, other than massage, physical therapy is very important. And I want to remind you that within the Supportive Care Network, we have the special interest group on physical therapy. And we have very enthusiastic and friends that have given a lot of education and are continuing to do so. Herbal medicine is really used a lot in many countries, both in low middle income countries and in high income countries. The caution is the risk of interaction with chemotherapy and other treatments. So we have to focus on the safety as well. And as I said, in the whole world, complementary and traditional medicine, integrative medicine is being used. In the US, there are reports from 20 to 60%, especially of herbal medicine. In Europe, from 12 to 42%. In Germany, up to 60%. Canada, about 50%. In Asia, 50 to 80%. In some countries, even higher. In Australia, 30 to 50%, especially dietary supplements, herbal remedies, mind-body practices. In the Middle East and Africa, 30 to 65%, in some countries up to 90%. I'll be presenting some examples from different countries. One is from a study in Cameroon, which was in fact a thesis by people that we know the names of, the Glenn, and the supervisors was Maria Kruger and Hesseling. Improving early diagnosis and referrals to life-saving care for children with cancer in Cameroon. The authors investigated traditional and complementary medicine in patients and families, in patients that were treated with Burkitt lymphoma. And what they had found was the use of the majority of families of children with cancer had used traditional and complementary medicine before diagnosis, while only a quarter of families had used it after diagnosis. When they were treated, if they saw the effect of chemotherapy, they wouldn't use it. Unfortunately, the use of traditional complementary medicine sometimes resulted in before diagnosis, sometimes resulted in the delay of diagnosis and worsening cancer symptoms, and also financially was costly to families because it didn't benefit and they had to pay a lot for that. And half of the parents and guardians were not willing to disclose the use of traditional complementary medicine to their treating healthcare team. This is very important. I will be telling you about this. We, as the healthcare team, have to be quite gentle in asking these questions so that they should not to scold them, to respect what they want, but then to teach them whether this is safe to use or not safe to use. Okay. And another example from Europe, from the SIOP Europe brain tumor group, in which I took part as well. There were 120 parents and 75 physicians that were surveyed in 2020 on children with diffuse intensive pontine glioma, which we know is a very is a diagnosis with the small prognosis and which is usually fatal. And almost 70% of the parents reported that they were using complementary or alternative medicine for their child. But when the physicians were asked whether the families were using it, they said less than 50% were using, because most of the families were not telling the physicians, also in Europe as well. And most of the products that were used were cannabis-based substances, was the most frequently used form of traditional complementary medicine, followed by vitamins, minerals, melatonin, curcumin, and boswellic acid. And the main intention of the families was direct anti-tumor effect. Other motivations were side effects of chemotherapy to reduce side effects or increase comfort. And in fact, the users did not differ significantly regarding ethnicity or country of residence. Almost 50% of the physicians, as I say, in this study was found that were not asking or were not communicating with the families about the complementary traditional medicine. What about the Middle East? The Middle East is a bridge between West and East, and there's multicultural diversity. And there are a lot of complementary traditional medicine being used, like about 50% in Morocco, more than 60% in Turkey, more than 90% in studies from Saudi Arabia and Jordan. The use of herbs for treatment has been documented in the Middle East for generations. Plant remnants were already found in prehistoric sites. And in the Middle East Cancer Consortium, after 2000, we have conducted a lot of studies or surveys among healthcare professionals and families on complementary and traditional medicine. One of these was a quantitative study on the complementary traditional medicine use in cancer care, prevalence, motifs, and contexts. This was, here we had 339 respondents with almost 13 countries, and herbal medicine was regarded the leading complementary traditional medicine modality used. And it ranged from 79 to 96% in some of the countries. And the patient's possible motifs was to cure cancer. That's what the families wanted, to use this to cure cancer. And the second was to improve the quality of life. Another study that we did, 1 minute, sometimes it is not moving. That's why I'm trying to move it. Next, yeah. Another study, a qualitative study that we did, was to find out the barriers to complementary traditional medicine integration in cancer care. The most important was the oncologist's skepticism and objection to complementary traditional medicine, the patient's unfamiliarity with the concept of it, although they were using it, suboptimal matching of these modalities to patient cultural and religious codes and beliefs. And the recommendations for better integration of complementary traditional medicine and supportive cancer care was focusing on doctor-patient communication on complementary traditional medicine, the integration of the modality, and improving quality of life to convince the parents and the families that it is usually not cure, but it is improving quality of life, and to reduce the oncologist's skepticism on complementary traditional medicine. And because most of the people were using herbs, we had to know the potential risks that they could carry when we were using chemotherapy. And another study that was done was on the use, which herbs, 20 sources were reviewed, and 44 herbs were seen that were used mostly. 12 were regarded as food like onion, figs, tea, lemon, grapes. Some were spices like turmeric, cinnamon, black cumin. Seasonal fresh dishes like stinging nettle, that's used a lot in Turkey as a dish. And 34 herbs were referenced in an oncological context, which have been investigated in some studies, in oncological studies. I think one of the most important studies that was done by the Middle East Cancer Consortium in our studies and surveys was the one that was published in Cancer in 2016. What we did was, especially this was for the safety considerations. First, we had a survey on 339 oncology healthcare professionals from 16 Middle Eastern countries on a 17-item questionnaire, asking them especially to list 5 herbal products that were mostly used by their patients with cancer. And then there was a very extensive literature review on the safety-related concerns about the products that were used in these contexts. There were 44 herbal and 3 non-herbal nutritional supplements, and these were honey, camel's milk, and Zamzam water. The mostly identified herbal products were stinging nettle, which is usually used in Turkey as a dish, also seasonal dish, turmeric, garlic, black cumin, ginger, camel's milk, green tea. These were the mostly used products as traditional complementary medicine. And among these 44 herbal products, almost 70% were associated with safety-related concerns. These were grouped according to 3 predominant themes. One was the potentially harmful herb-drug interaction. The second was the directly toxic effects. And the third was the enhanced anti-cancer effects of conventional treatment through either synergy with herbal components or chemosensitization of cancer cells. And the potential harmful herb-drug interactions accounted about 34%, toxic effects about 40%, and 16% about the other. So the conclusion was that the herbal medicine use has several potentially negative effects, and oncology healthcare professionals working in countries in which herbal medicine use is prevalent need to better understand the implications of this practice, and they have to be respectful to the family, ask what they were using, and to convince them that although they were using these herbs or whatever other products, these were usually for supportive care, for quality of life rather than curing the patient. But we had to know what they are using and whether they can they have a negative effect in the chemotherapy. And I would like to lead you to this website from Memorial Sloan Kettering on the integrative medicine, where you can search for the herbs, for the actions, interactions, negative effects, and the studies that were done in oncology. I will be giving you some examples of these, of the mostly used herbs. So one of these was the stinging nettle. It is used a lot in Turkey as a fresh dish, as I say. Urtica dioica and urens, its Latin name. And there have been in vitro studies that have been shown that the extract and the essential oil of the stinging nettle can inhibit several inflammatory effects, can have cytotoxic and genotoxic effects, but also there were adverse effects that were reported like gynecomastia, urticaria, hypoglycemia, allergic reaction, rhinitis, and herb-drug interactions included hypotensive diuretics. So we have to be careful when we're using it. Curcuma longa, turmeric, Indian saffron is also a very widely used spice. It is proposed use for inflammation, arthritis, infections, but it can cause adverse effects like allergic dermatitis, contact urticaria, toxicity when used with paclitaxel, autoimmune hepatitis, oxalate nephropathia. So especially if the patient is using anticoagulants, antiplatelets like aspirin, or camptothecin, metocloramine, cyclophosphamide, norfloxacin, amphotericin B, these may have some negative effects. Garlic is used a lot, and garlic is especially used a lot in the Middle East and in many countries. And it is proven especially to be effective for hypertension and for infections. And the purported use also is to use it for cardiovascular disease or cancer. One of the products that is in the cells of the garlic, the allicin, has antibacterial and antimicrobial activity. Also, it has antiplatelet and antihyperlipidemic activities. So if a patient is using antiplatelets or anticoagulants, we have to be careful. So using it in the dishes, like using onion or garlic in the normal dishes that we every day, the families, the mothers are cooking or the fathers are cooking, this is okay. But to give it as a medicine in large amounts, this may have negative effect. Black seed, Nigella sativa, also has been shown to be good for radiation therapy side effects. But also there is a concern that it may also decrease the effect of radiation therapy. So we have to be careful in the patients that are getting radiotherapy at the same time. There has been a very nice review, a narrative review, published in the Pediatric Blood and Cancer by our colleagues from United States, Canada, and I think Glenn from Cameroon, yeah. And Elena Ladas, was the chair of the nutrition group in the PODC time, and also she has been a very active member of the nutrition group, and she is the leading person in nutrition in Columbia University in New York, and she's very active in SIOP, In this review, there are the definitions of the everyday used products. Let me tell about some of these, because I have just want to highlight the ones that we need to know, like what is a functional food or bioactive food. These are whole foods with potential health benefits beyond basic nutrition, often promoting health and reducing the risk of disease. What are bioactive compounds? These are substances typically found in functional foods, such as probiotics, fiber, minerals. Supplements are non-food substances or combination of substances, including vitamins, minerals, herbs, plant-based products, or other bioactive compounds. Nutraceuticals are foods that include both functional foods, the first one, and foods that have been supplemented with additional bioactive compounds for the purpose of improved health. Immunonutrition is the use of specific nutritional supplements or foods to modulate the immune system. And some other definitions for some very widely used products, the prebiotics and probiotics. What are prebiotics? Prebiotics are compounds that induce the growth or activity of beneficial intestinal flora. But probiotics are live microorganisms consumed to supplement. So they are live microorganisms consumed to supplement, restore beneficial bacteria. They'll help maintain natural intestinal microflora. Although probiotics are usually very much recommended for healthy people, in immunosuppressed people, because they are live or microorganisms, there's always a concern for infections. And in fact, there has been reports of probiotics like lactobacillus given in large amounts and that have caused sepsis. There has been a children's oncology group randomized control trial in the United States on the effectiveness of Lactobacillus plantarum in preventing GVH, graft versus host disease, in children undergoing transplantation. The clinical, this was of course given at a certain amount at a certain time of the day. So the clinical, up to date, the clinical benefit, appropriate strain, dose, and optimal administration of probiotics remain to be determined. In fact, this was discussed in one of the SIOP annual meetings at the educational days. Elena Ladas had given a very nice lecture, and we had asked her also, she does a lot of extensive studies about yogurt, because yogurt is used a lot in the Middle East and also in many parts of the world, and it does contain, in fact, probiotics, natural probiotics. Pasteurized yogurt is recommended because especially in the past, usually yogurt would not be given to cancer patients, but pasteurized yogurt is recommended that they can get the pasteurized yogurts. Antioxidants prevent oxidation and theoretically protect the body from oxygen-free radicals and cell damage. Antioxidants are found naturally in foods and can include vitamin C, E, some minerals, selenium, flavonoids found in fruit and soy. However, high-dose antioxidant supplementation that exceeds the upper limits as defined by the dietary reference intake should be discouraged. Vitamins and supplements. Vitamin C supplementation is recommended, especially in adults, a lot, but it has not been specifically studied in pediatric cancers. Vitamin D is purported to have inflammatory and immunomodulatory effects. It is important to ensure children with cancer to have sufficient vitamin D intake, especially now in the wintertime in our area. It is good that we ensure that they can get sufficient vitamin D intake, but not overdose. And plant-based bioactive compounds, nutraceuticals, some examples. Raw honey is used a lot. Propolis honey is recommended a lot for healthy children, but raw honey can contain spores of Clostridium botulinum, which may confer a significant risk to immunocompromised children with cancer and infants less than 1 year of age. So caution should be used, especially in consuming raw honey. Milk thistle, it is, for example, we have it in the Middle East a lot, and in some countries also, have demonstrated a decrease in liver enzymes and total bilirubin levels. And in fact, there was a study that was done on the use of milk thistle in ALL to reduce the liver enzymes, and it was found to be safe. Black seed oil also is reported to decrease the liver enzymes. Glutamine has been investigated as a potential intervention for vincristine-induced neuropathy and also for mucositis. And what about diets? Because, you know, especially the families around them or their family members usually recommend a lot of different diets to them. And so they come and ask you whether this is good or not. What is a ketogenic diet? A ketogenic diet is a high-fat, low-protein, very low-carbohydrate diet. It has been proven successful in intractable epilepsy. The rationale for the ketogenic diet is the Warburg observation that cancer cells rely on glucose for metabolism. However, evidence in cancer is lacking and no high-quality studies in pediatric cancer patients. There is a phase 2 trial of the ketogenic diet in patients with relapsed and refractory brain tumor patients that is currently underway, but until we prove that it is effective or it is safe, we do not recommend it. Calorie restriction diets also attempt to starve the tumor cells so that they lack glucose, and when the cells starve, they can cure cancer. However, there is a risk for pediatric patients because they cannot get essential micronutrients. They can cause weight loss, muscle wasting, and lead to impaired tolerability of chemotherapy. So it is not recommended. Whole food diets are recommended both by the American Institute for Cancer Research and the American Cancer Society. Encouraging a diet high in vegetables and whole grains is congruent with recommendations for a healthy diet by these organizations, which are well respected. Immune boosting and modulating diets aim to boost the immune system. This has not been extensively investigated in pediatric patients, so we cannot recommend it as yet. However, in adults requiring gastric surgeries, immunonutrients such as arginine, glutamine, polyunsaturated fatty acids, or others to optimize healing has been shown to be effective and cause fewer infectious complications. So there is a lot of gap for that research can be done on in pediatric cancer about these diets. Let me try to move to the next. So many nutritional, traditional complementary medicine strategies exist and are used by pediatric patients with cancer and their families. Although these strategies are popular, rigorous studies of their safety and efficacy are often not available. Children with cancer should be encouraged to eat well-rounded diets that include fresh fruits, vegetables, whole grains, lean proteins to meet their dietary needs, and that will provide adequate and safe amounts of the beneficial compounds found in food. And vitamin D especially, we wanted to give to supplement it for the well-being in the normal dosage, not overdose. There are also a lot of targeted studies of cannabinoids and a cannabinoid oil that are being widely used by families, but we have to remember that these may cause significant adverse effects, as I will show the ASCO guidelines. Research consortia, such as the Children's Oncology Group and other consortia in many countries, have the resources and expertise to continue to lead ongoing investigations of incorporating traditional and complementary medicine strategies into cancer care. And now I would like to also talk about some of the guidelines that were published. These are mostly of adults, but still we can get some information on these. The ASCO, the American Society of Clinical Oncology, which I'm a member of also. I am at the moment the chair-elect of the ASCO, American Society of Clinical Oncology, IDEA program, which is the International Development and Education Committee. And in ASCO in 2018, I was awarded the Woman Who Can Cure Cancer Mentorship Award, giving for international women who have shown leading features in international oncology, which I'm proud of. And in fact, the ASCO have collaborated with the Society of Integrative Oncology to produce some guidelines on integrative therapies. These are for adults, but we can also get some information generally. There is strong recommendation for the management of cancer fatigue, strong recommendation for depression, and recommended modalities for managing anxiety. So for fatigue, depression, and anxiety, using mindfulness-based interventions, both during and post-treatment, have been recommended, like yoga, hypnosis, relaxation therapies, music therapy, dancing, if the energy of the patient is enough, the reflexology, acupuncture, or some Tai Chi or lavender essential oils. Clinicians should recommend against using cannabis or cannabinoids as a cancer-directed treatment, unless within the context of a clinical trial. This has been emphasized because there are potential side effects like psychosis, anxiety, hyperemesis, cognitive impairment, drug interactions, especially with the cytochrome P oxidases, case reports of cannabis interacting with warfarin causing high levels of anticoagulation, bleeding, detrimental effects during immunotherapy. These may be related to the anti-inflammatory effects of cannabis, similar to the use of steroids during immunotherapy as well. There has been one randomized controlled trial for chemotherapy-induced nausea and vomiting, which showed some benefit. And this is of note, but that was for nausea and vomiting. And the ASCO guidelines, especially on exercise, diet, and weight management, have reviewed 52 systemic reviews, 42 for exercise, 9 for diet, 1 for weight management, and additional 23 for randomized, where they reviewed 23 randomized controlled trials. These were mostly for adults, breast, prostate, lung, colorectal, but these are examples that can be, these kind of systemic reviews can be done for children with cancer. And these are gaps in the research for these kind of traditional complementary medicine, which I want to say, so that these kind of trials may be done by enthusiastic scientists as you are. So exercise during cancer treatment led to improvements in cardiorespiratory fitness, strength, fatigue, and other patient-reported outcomes. So exercise is recommended. In fact, we also recommend always exercise for children. Neutropenic diets did not decrease the risk of infection during cancer treatment. Neutropenic diets are not recommended to prevent infection in patients with cancer during active treatment. Of course, we want them to eat clean food, but it doesn't have to be neutropenic diets. In fact, there was a nice paper that was done in Europe. Thomas, who was one of the previous co-chairs of the supportive care of the SIOP, had led that study. on it was a survey on, for example, whether neutropenic dye should be used, what were the recommendations of healthcare professionals in different European countries, for example, whether they can have pets in the house and that kind of thing. So usually the consensus is that at the moment, of course, in special circumstances, very immunosuppressive patients, it may be different, but neutropenic dyes are not recommended to prevent infection in patients with cancer during active treatment. But of course, they have to eat and drink always clean food and clean water and clean fluids. And another guideline was for pain management in oncology, and this was based on 227 relevant studies to inform the evidence base for this guideline for adult patients. Acupuncture was recommended for aromatase inhibitor-related joint pain. This is usually used for breast cancer, you know. Acupuncture, reflexology, acupressure may be recommended for general cancer pain, musculoskeletal pain. Hypnosis may be recommended to patients who experience procedural pain. In fact, hypnosis has been in some of the, in the Middle East Cancer Consortium, we had very nice courses for palliative care. And one of the, Frederick, who also had given lectures in previous SIOP educational days, had shown how you can do hypnosis for procedural pain. So in children also it may be used, but of course you have to be trained for it. Massage may be recommended to patients experiencing pain during palliative or hospice care. Of course, these are all intermediate level of evidence and moderate strength of recommendation. For pediatric patients, there's insufficient or inconclusive evidence. This has also been stated in this guidelines. So in conclusion, integrative medicine offers additional supportive care options for pediatric cancer patients, focusing on holistic well-being. Foster a supportive environment where families feel comfortable discussing we have to foster a supportive environment where families feel comfortable discussing their preferences and concerns. We have to ensure all team members are informed of any integrative therapies used. And here we have to also educate our colleagues or our students also that not to scold the families because they are using traditional complementary medicine, but to ask them. One of our mentors, in fact, Professor Nijat Bilge, he was a radiation oncologist, may he rest in peace. When we had started fellowship, he had told us, well, all of these patients, most of them will be using herbs or other traditional medicines. So do not scold them. To ask them with respect if they are using anything, and if they are using, tell them that, well, we do not think that when we are giving chemotherapy or radiotherapy, we know the evidence, but with these herbs or whatever, we cannot use them if we don't have the evidence. And if they wanted to use it, we have to know whether there was any negative effect when they were using for chemotherapy. For example, we know that pomegranate and grapefruit is not being used, shall not be used with chemotherapy because of its negative effect. But especially even if they are to use it, they shall not use it in the days that they are getting the chemotherapy or the days that are near the chemotherapy, because most of them will want to use it and not to use them in extensive amounts, and always take note of what they are using and try to convince them if it is something that is not harmful, okay, you can use it. But if there is something that's harmful, please tell them that this may be harmful for your child. Clarify that these therapies are only supportive and do not replace conventional cancer treatments. That's very important. And the safety considerations are very important, as I have shown some examples. Discuss potential risks and benefits with patients and families. Regularly monitor for side effects or interactions. In many of our countries, the human resource is very low. The number of patients and nurses are really not too many to have too much time to discuss. But even though we have a limited time, try to do it, because this will also make the bonds of the families and the physicians and the nurses and other healthcare professionals better, so they will respect you more and they will try to do what you want more. Adhere to regulations and standards for integrative therapies in children, like cannabinoids. We have written that it was also in the ASCO guidelines that it is not recommended, but also in many countries it is not allowed legally as well. So we have to be we adhere to regulations as well. And the collaboration between all care providers and ongoing education are critical to ensure safe and effective use of these therapies. And with this, I do conclude my lecture. And if you have any questions, comments, we're here for those comments and any questions. Thank you so much for listening.
Thank you so much, Professor Rejin. It was really fantastic, very informative. I want to start with the two questions. At first, you know that the disclosure rate from the patients is usually very low. I think because they are very believing on such traditional medicines. This is one point, and from the other point, they think that the doctors have low experience with such treatments, and this is real, I think. For example, in my home country, it was not a part of our studies in the Faculty of Medicine or within a part of the subspecialty exam. Do you recommend that it must be a part of our studies? Because nowadays, I think most of the people, as you said, more than 6% are using it.
As well, in fact, many years ago, in one of the SIOP annual meetings, I was moderating the free paper session, and there was a very nice paper, an oral paper from Germany. And in Germany, it was about 72%, more than 70% using some herbs or homeopathic medicine. So I think it is, well, the curriculum, the medical curriculum in medical oncology also is so full in pediatric oncology. It is good at least to have it may be only one lesson, one session, but it is at least good to inform the students when they are being in medical school. And during our Pediatric Hematology-Oncology fellowship, I think this has to be implemented into the curriculum, at least as a one session, two sessions, so the physicians, nurses, and other healthcare professionals should know that there is the traditional complementary medicine is being used. As I say, as we started the fellowship, Professor Nijat Bilge was very supportive on this because they will use it. He was really one of the pioneers in oncology, and he said they will use it. So don't scold them, because most of the time it would be used. At that time, usually, it would be seen like, because this is using alternative medicine, we don't want alternative medicine. We want them to use the conventional medicine. But to integrate these kind of things, like putting garlic in the foods or that kind of thing, if they are not harmful, they will use it anyway. If you at least tell them about it, if they are using something harmful, then they will usually tell you about it. But most of the time, if you say, well, you shall not use anything, and so on, then they will, as we have seen in many studies, many doctors think that they are not using it, but they are using it when you ask the families, yeah.
And just another question. Yeah. What's your opinion? Shall we consider the religious therapy as part of the complementary and alternative therapy or not? Because in many populations, it's a part of our daily life.
Spiritual therapy is also important. In fact, we have a very nice publication on the spiritual therapy of what people, the healthcare professionals and the families think about it, that we had published in a study in Middle East Cancer Consortium. I will send it to you. Then you can send if you want to the members of the traditional and complementary medicine as well. Spiritual therapy is important, and in fact, we have a paper that has just today been accepted from our Istanbul University Oncology Institute on this subject. I will just tell you about. Just a second. 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 It is on the religious coping strategies of mother who lost their children to cancer in Turkey, a qualitative study. Religious coping is important. I mean, we have to respect all kind of religious or beliefs. I mean, it may not even be a religion, but all kind of religion and all kind of beliefs, because this is a way of coping. It's like the mindfulness, like what we said about the mindfulness. It is a way of coping for the families, sometimes for the patients. So we have to respect them as well, yeah.
Then we open also the discussion for any other questions.
Yeah, of course.
Or to write on the chat.
Discussions, any comments. We at the moment, I didn't see how many we were before, but now we are 26. I see that. And I see that we are from many countries, from Turkey and other countries. If there are any questions, any comments, or you want to give examples of your countries, of your centers, we can do it. As I say, we as professionals, I do a lot of sarcomas, brain tumors, lymphomas, everything, but also we have to always think of the patient, a holistic approach, the patient as a whole, with the psychology, everything. And in fact, in the Istanbul University Oncology Institute, we have the Preventive Oncology department, which I am the head of. And there also we have the palliative care PhD program. It's the palliative care and supportive care PhD program, and there also we talk about we talk about the traditional complementary medicine as well, and to respect them as well, yeah.
And also, may I ask about the abundance in your country, in Turkey? Is it?
Well, in Turkey, let me tell you that in Turkey, we have the cancer registry of the Ministry of Health and also of the Turkish Pediatric Oncology Group, which is led by Professor Kutluk. And the survival rate of pediatric cancer in Turkey nowadays, in 2008, it was 68%, 65%, and nowadays it's 71%. In our Istanbul University, in the study that I did for 22 years, which we published in 2012, 1990 to 2012, it was 75%. And afterwards, in the next 5 years, it was almost 80%. The abandonment rate has gone down quite really. I had started my fellowship at the beginning of in 1990, but within these 34 years, there has been a very important improvement, especially because of universal health coverage. That's, I think, the most important thing. You know, I represented SIOP last year in 2023 in September in the United Nations General Assembly, where I gave a small talk on, especially on what SIOP is doing for GICC and global oncology, pediatric oncology, and also that universal health coverage should be in all countries. In 2002, Turkey accepted the universal health coverage. So every child that has cancer is covered for the diagnosis and the treatment of cancer, regardless, even the refugees that are officially registered in Turkey, they are all covered. And this has reduced the abandonment rate to really almost to null, to 0%. Because children, especially education, is very important. The education of the population, the social media is very important, because usually, you know, cancer is regarded as death in many low middle income countries. But if you show that cancer can be treated, those in social media especially, this is very important. The medical societies, the Turkish Pediatric Oncology Group, Turkish Pediatric Hematology Group societies that we have, or we as senior oncologists, in many of the interviews that we can do with the newspaper or the television. Television can reach so many people, I think, that cancer may be treated. This also educates the population. And so when they have, when the child is ill, whether it is cancer or other chronic illness, they can go to the hospital as soon as possible. So it is very important that there's universal health coverage, both for treatment, but both also for the diagnosis, because having an MRI, having the medical treatment, these are all expensive things. And if the family has to pay it out of pocket, they can think, well, cancer, they will die anyway. Because in the past, we had experienced that they would, like in the 1980s, when they had cancer, and if they lived far from the big cities where there were the university hospitals, they would not bring their children. But nowadays, there are many hospitals, there are the university hospitals in many, in the big cities, but also in many parts of Turkey, because Turkey is a big country with 80 million people. And when they have to be they have to be transferred, the government pays for the transport as well, for the patient and one caregiver, so they can come. This is, I think, very important for all countries to reduce abandonment and to have higher survival rates.
Thank you so much. I mean, just to summary, you are very right to say that it's about educational thing and financial thing, because many patients until now think that the cancer therapy will just bring side effects, but will not treat the cancer itself. And because of that, they are looking for the traditional complementary medicine and abandon further therapy. You are totally right. Thank you.
And the success stories are very important. The success, because usually, of course, we never disclose our patients if they don't want to. I mean, sometimes the families, they don't want to know they don't want that the people know that their child or their girl had cancer, because they have concerns for the future, that they cannot marry, and so on and so on. You know, about there's a lot of cultural pressure on that. But the success stories are very important in the media. Like when there is a success story, for example, we have a lot of patients that were cured, are doctors now, are engineers. And one of these doctors, he is really very active in the social media also. And this is a success story. Like, he was advanced stage lymphoma and is a doctor now. These kind of success stories, I think are very important for the population to have to think that cancer can be treated, and cancer, they can be survivors. Yeah.
Is it a routine part of your first meeting with a patient in the diagnosis stage or something like that, to discuss with him the possibility of traditional complementary medicine and these things, or you are waiting until they start to discuss it?
Usually no, because you know, the first discussion is so there is so much psychological pressure both on the child and the family. First, we tell about the diagnosis to the parents with all the truth. To the patient, we have to tell according to the age of the patient and according to the cultural differences. Many of the parents in Turkey would not allow us, or would not, they don't want us to use the word cancer. And at the first, although we have to say everything correct, we respect them. What I say to them is that we cannot lie to them. If they ask, I cannot say no, you don't. If he says, do I have cancer? I cannot say, no, you don't have cancer. But if it's a small child, we can say that we have a lot of cells in the body. Some are naughty cells that do not listen to us, and they grow and grow, and we have to win against them. We have to make them go away from our body. If it is an adolescent child, we say that, you know, in biology, or you had read that the tiny part of our body is the cells, and these cells grow, but sometimes they grow without control, and they make a lump if it is a solid tumor, which we call a tumor. We make a compromise with the family. I will use the word tumor, but not cancer, until the time comes. And I will ask you again your permission to say that it is cancer, because most of the, mostly it is, especially adolescents. Now they have, you know, the internet, they know about everything. They lie to each other. The parents try to avoid the word cancer, and the child sometimes tries to protect himself also, not to use, although they know they have cancer. I had a child that died of Ewing sarcoma, and in fact, she had recorded a lot of videos and gave them metastatic Ewing sarcoma, who had a complete response, but then recurred and at the end died. She was really a very intelligent girl. She was an adolescent. Some videos that she gave to the sister to be given to the parents after she died. And in those, she was explaining that she knew everything. She knew about everything, but she didn't admit it to the parents, because then the parents would be very sad. So they were playing to each other. It was a theater, they were playing to each other. Of course, we told her about the cells, that they were growing, and if they came back, and we'll try to give some more treatment to give to let the cells go away and all that, with avoiding to use cancer, because otherwise the parents would not bring the child. So, I mean, sometimes you have to respect the cultural sensitivities to move forward, because you want to treat the child, you want the parents to bring the child, and psychologically they have their reason, but it needs sometimes a month until we use the word cancer to first the parents get used to it, and especially if they see a response, then they feel better. So we ask them. I think we tell them now. We think it is the time that we tell them. If he asks, it is cancer, but cancer, it can be curable. Yeah.
So we are waiting for other questions from the attendees, and Roberto also, if you have any other questions.
No, thanks for your presentation. It was really impressive that you have all that information. It was really illustrated. And I would like to know how your program works at your hospital, maybe, or how the patients can access to the integrative medicine. You say to them with the conventional team at the beginning, or they can go and ask for an integrative medicine consultation. Just
Dear Roberto, we don't have a traditional and complementary medicine department. We are the Pediatric Hematology-Oncology department. As I say, in low middle income countries, most of the time, we are limited people. The number of doctors, the number of nurses, we are limited. We don't have a psychologist always on board. We have to ask for a consultation for the psychologist. For the physical therapy, we have to ask for the consultation. But nowadays, we have a dedicated professor that comes every Friday for the physical therapy. So there are very limited people. So there is no. So it is always the physicians and also the nurses that talk about the traditional complementary medicine. We don't have a special person that is dedicated to that. So in our countries, we have, when we are training, we have to train our students, our fellows, our residents about it, because especially in the near future, now we are short even of pediatric hematologists, oncologists, because it's very hard. People do not want to get into pediatric hematology-oncology. So even when we have pediatric hematology-oncology in our fellows, it's so happy. We are so happy. So we would like to have a traditional complementary medicine department and a special person or a special nurse for it, but we don't have it. So we have to train with these conferences or within our international inner training. We have our training for the nurses for communication, for palliative care, and within those courses we put the traditional complementary medicine, how to approach about it with the families. But we do not have a special person, so we have to take care of all that. It is a big burden, but we have to take the burden of the psychiatrist, of the psychologist most of the time, until they really need to see one, or we have to ask for a consultation. This is usually what happens in most of the low middle income countries, because the number of people, professional persons are limited. Ahmed, maybe you want to comment on that about Egypt as well? Yeah.
Yes, also in Egypt, unfortunately, it's the same situation like in Turkey. But just in Europe, I have noticed that it's very well integrated to the hospitals. Most of the nurses have good information. There are a lot of centers just for the integrative medicine. And because of that, maybe daily we have questions from the patients about some of the integrative medicines.
Yeah, the thing is that when we're educating the residents and fellows and nurses, we have to say that there is traditional complementary medicine. They will use it. Don't scold them. Listen to them. Listen to them and try.
And what's very interesting also,
if you don't know if it has a negative effect, say, please wait until I've tried to find out.
The problem, many times we don't find any information. And the other problem is when you work in any international hospital, you have a lot of international patients from the whole of the globe. And then everyone brings his traditional medicine with him. because of that, it's something rare for us, for example, here, and it's more and more difficult. And they are believing so much on these things. Yeah.
Yes.
Any other questions from the attendee?
I think everyone can open their camera, Anelia,
Yeah.
and you can have the screenshot of this
Yes, sure.
for the traditional complementary medicine.
Okay, great. I
Good.
can take some photos.
Okay, you can, yeah, you can take, yeah. You can open the cameras. So Ahmed and Roberto, you have a remembrance and me of today's with all of the members that have participated.
Okay, so I'm taking some photos now. Great, thank you.
Thank you, Professor Rejin. Thank you so much. It was really very informative for us, and it gives us pleasure that you were with us today. Thank you so much.
Thank you so much for the invitation, and thank you being with you. It was a pleasure, and we hope to be in SIOP in Amsterdam face to face. We will see each other face to face. We hope so. Bye.
Thank you. Bye-bye. Thank you.
Thanks.
Bye-bye, everybody. Bye-bye.
Bye.